Aging isn't just about wrinkles and reading glasses, it's about energy. More precisely, it's about the slow, subtle decline in mitochondrial performance, where your cellular power plants begin to sputter instead of hum. At the core of this metabolic fatigue is a molecule that rarely gets the spotlight outside of supplement shelves, coenzyme Q10, or CoQ10. It may not sound glamorous, but this lipid-soluble compound is like the spark plug of your mitochondrial engine. Without enough of it, your cells produce less ADP, oxidative stress rises, and the systems that rely on high energy output, like your heart, start showing signs of wear and tear. If you've ever felt like your get up and go quietly got up and left sometime after your 40th birthday, CoQ10 might be worth a closer look. CoQ10 lives primarily in the inner mitochondrial membrane, where it plays a central role in the electron transport chain, shuttling electrons between complexes 1 and 2 to complex 3. This isn't just molecular busywork, it's how ADP gets made. The more efficient this process, the more energy your cells can generate. In youth, the body usually produces sufficient CoQ10 on its own, but levels naturally decline with age. By the time you're in your 70s or 80s, tissue levels of CoQ10 may be 30 to 60% lower than in young adulthood, particularly in high-energy demand organs like the heart, kidneys, and skeletal muscle. And like many things in aging, that decline isn't just a cosmetic issue, it's a functional one. In cardiovascular disease, the CoQ10 story becomes even more compelling. The heart is one of the most energy-hungry organs in the body, beating roughly 100,000 times per day, every day, for your entire life. That takes a lot of ADP and a lot of mitochondrial output. Studies have found that individuals with heart failure often have significantly lower myocardial CoQ10 levels, and that supplementation can improve ejection fraction, reduce hospitalization rates, and improve quality of life. One of the most well-known clinical trials on this front, Q-SYMBIO, found that patients with moderate to severe heart failure who took 300 milligrams of CoQ10 daily experienced a 43% reduction in cardiovascular mortality compared to placebo over 2 years. That's not just a footnote, that's a life-extending effect. Then there's the statin connection, which gives CoQ10 a second act as a therapeutic companion. Statins, widely prescribed to lower cholesterol and reduce cardiovascular risk, inhibit the enzyme HMG-CoA reductase, unfortunately the very same enzyme involved in CoQ10 biosynthesis. It's a bit like hiring a housekeeper who also happens to unplug your fridge. While you get the lipid-lowering benefits, you also risk reducing endogenous CoQ10 production, particularly in the liver and muscle tissues. This drop in CoQ10 is believed to contribute to one of the most common statin side effects, myopathy, which includes muscle aches, weakness, and fatigue. Several small but promising trials suggest that CoQ10 supplementation may reduce the incidence or severity of statin-associated muscle symptoms, SAMs, offering relief without compromising the lipid-lowering benefits of the drug. It's a rare example of a supplement acting as a pharmacological peacekeeper. Beyond energy production, CoQ10 also moonlights as an antioxidant. In its reduced form, ubiquinol, it protects mitochondrial membranes and lipids from oxidative damage, a big deal in aging, where reactive oxygen species, ROS, are busy carving graffiti into your DNA and cellular machinery. By buffering oxidative stress, CoQ10 may help preserve mitochondrial DNA integrity and delay the kind of cellular dysfunction that underlies age-related diseases, including neurodegeneration and metabolic decline. Some studies even suggest that CoQ10 may support endothelial function and reduce arterial stiffness, further reinforcing its cardiovascular credentials. But what about bioavailability? Here's where things get a little more biochemically moody. CoQ10 is notoriously difficult to absorb in its standard form, especially when taken on an empty stomach. Formulations that include oil suspensions, nanoparticles, or the reduced form, ubiquinol, tend to have better absorption rates. Some people take it with fat-containing meals to enhance uptake, while others opt for liposomal or solubilized versions. The point is, not all CoQ10 supplements are created equal, and more isn't always more if your body can't actually use it. As always, personalized strategies win the day. If you're a healthy 30-something with robust mitochondrial function and no statin use, a high-dose CoQ10 regimen may not do much. But if you're older, on statins, or managing heart failure, CoQ10 moves from nice to have to clinically relevant. It's generally well tolerated, with doses up to 1,200 milligrams per day showing safety in trials. though the sweet spot for most cardiovascular benefits appears to hover between 100 and 300 milligrams daily. In the grand scheme of aging, CoQ10 is a reminder that energy isn't just a feeling, it's a function. It's a molecular currency that we start to run short on as the years pass, and supporting its production may be one of the simplest ways to preserve vitality at the cellular level. Whether you're trying to reduce cardiac risk, buffer the effects of statins, or simply give your mitochondria a fighting chance, CoQ10 offers a gentle yet powerful push in the right direction. Not flashy, not faddish, but fundamental.